It's because I could feel it's like, you don't do that to human beings.
Sure.
This is not a game. This is not a joke. These people are dying. These people are scared. They're being made more scared by the information being fed to them to go hide in your homes, go put a mask on, believe that everybody has an infection. They're going to kill you, or you're going to kill everybody else, and just wait for us to come up with a vaccine that's going to cost $3,000 or whatever we want to charge for it,
Right.
or charge you remdesivir. But for the love of God, don't take hydroxychloroquine, or don't listen to your doctor, because your doctor might be right, and that's just going to take away from it, and that'll take away from the fear. You know what? Quit causing panic. Start pretending like you really care about the patients. Conduct studies that actually measure what's happening in the tissue. This is long past due. There's no excuse for it. We've got the best universities, the best hospitals, some of the best doctors, some of the crummiest doctors, some of the crummiest hospitals, some of the crummiest universities.
Right.
Okay, but we've got some of the greatest. And we have people that day in and day out, I hear from them the compassion and the concern for taking care of these patients, and they want to be allowed to do their job. And instead of handcuffing them or pulling the wool over their eyes or telling them they can't do something or threatening to put them in jail or threatening to take them to court because they're trying to do the best thing for the patient, when you have no better answers, you really should stop it. You should really start thinking about the patient and the people that are scared, because there's nowhere that I go that the people aren't panicked.
Yeah.
And why?
I've been upset with the corporate media again for that very same reason. Like, as soon as something like this happens, you really have to make a choice. Like, you either need to help calm people down, which seems to me, the logical thing to do, because living in a state of panic is not, conducive to coming up with the best solutions.
No.
And it just seems like they've been amping up the fear, and I don't know what to do. I mean, that's why I have conversations with people like you to try to take a step back. Look, there are solutions. There's ways to approach this that make a lot more sense, and hope that people, can get a little bit of distance from what they're getting inundated from the corporate media every day. That's trying to keep them on edge and trying to keep them thinking that this invisible virus is lurking around every corner. So
It's a virus. It's going to infect people. It's not going to stop infecting people. There's
right.
going to be another one after it. This is really, in some ways, I've considered this. It's really kind of verification of the inflammation theory, for lack of a better way to look at it. And it's really kind of our event horizon as a species, I think.
Mm-hmm.
This is where we make a decision about how much we want to intelligently think about things, or how much we want to behave like primates and scared chimpanzees because we hear a sound in the bush. We can either
Right.
approach this intelligently and calmly and rationally and do the work that needs to be done to investigate the drugs and the treatment responses, or we can continue to scare people and manipulate people, which I suppose is great. If you have a power thing and you want to do that, I think you are probably being fed better than you should be. But you are scaring the blazes out of so many people that are asking for help, and they will surrender to you whatever you want for the promise of safety.
Mm-hmm.
The problem is the promise of safety that's being held out is a carrot on a stick, and it's not a promise of safety. And it's not even coming with the compassion of really caring. I'm unconvinced of those who stand up and go, we really care. We stay 6 feet apart, wear a mask, don't spread it to other people. Okay, this is July 2020. We've had more than enough time to approach this intelligently. The people that are approaching it, the failure or the lack of people to want to share real data, real information, and to attack people that are not standing up and spouting the status quo is a marker that there is a major problem. And it's not the absence of the ability to solve this problem, it's the desire to promote fear and anxiety and use this to manipulate for whatever purpose they can.
Yeah. Yep.